Well, good afternoon, everyone. Welcome to the third and last plenary session of the European Health Management Conference 2026. Great pleasure to see those of you that are still here after 3 long days. So thank you for being here. This plenary is from strategy to action, implementing workforce transformation. This is a topic that is very dear to Emma, on which we are working with a lot of our members and that we know has a lot of attention across Europe. I would also, before we go into this, let you know that this session is accredited. So I see a lot of people are scanning the QR code, which is exactly what you should do. And you should fill out the little survey so you can claim credits. And this same QR code will reappear at the end. So don't worry if you don't manage to scan it now, it will come back. So I am the Executive Director of the European Health Management Association. I will be the facilitator for this session. I'm joined by a wonderful panel. What we are going to discuss today is ways to upskill and reskill the health and care workforce. Specifically, we will speak about the work that we have done through the BeWell project, and so the focus that we have done on digital skills, green skills, and core skills. But we're also very happy to have here a representative of the Ministry of Health of Slovenia, and that will tell us a little bit more what happens on the ground, a representative of EURIGA, so local and regional health authorities, that will tell us what happens across Europe in terms of implementation. And we also have a representative of, yes, the business school, but specifically of another project, BRIGHTskills, that looks at skills for the industry professionals. And so, without further ado, I would start with you, Ronald. So we have Professor Ronald Battenburg from Nivelles. He has been a partner in the BeWell project. And Ronald, you, together with colleagues from the European Observatory on Health Systems and Policies, have looked into some skills intelligence. And so, can you tell us a little bit more about the findings in terms of digital skills that you have identified? Or green skills, whatever you want to start from.
Thank you, Federica. Now it works, yes. Thank you, Federica, and thank you for inviting me to this panel. Actually, I would be here with Gemma Williams, who is on the program, but she has a wisdom teeth infection. Don't get this, because you're not allowed to fly. So she cannot be here, and we wish her well, of course. And, well, this is a collaboration between Nivelles and European Observatory with regard to the Skills Intelligence work package of the BeWell project, which has finished. And actually, what are the results? Well, there are two physical results, being the 2 policy briefs. There you go. Here they are listed. Here you can scan the QR code, but if I'm not mistaken, they are also available as hard copies on the desk here. So please take them, read them, and there the answers, not to everything, are provided, but mostly about definitions, of course. What are we meaning? What are we talking about if we talk about digital skills and specifically green skills as a new type of skills development, you could say, and also what are the implications? That is the key message. And the starting question is, of course, is there a skills gap with regard to digital skills, green skills, soft skills? And indeed, there is a gap if you go by the surveys that have been done. So if I go back to 2016, there was an OECD report, the right jobs, the right skills at the right places. So very appealing title. And back then it was also already reported that 50% of the physicians and 40% of the nurses experience being underskilled in certain areas, not all areas. And one of them is absolutely also digital skills. So these can be simple user skills. You would be surprised how many health professions are fighting daily with the IT part of their job, leading to frustration, but also showing that there is a skills mismatch there. And so simple usability factors are still important. because digital applications grow, mobile applications grow. There's a lot of new stuff going out there, and they need to work with it within their organization, but also with their patients and colleagues in terms of the communication. And the advanced skills is, of course, what does AI mean for professionals? And that is actually, I would say, it's an advanced form of decision support systems. But of course, in a very new type of technology and algorithm, and it's important to have a digital skills to understand what are the algorithms behind it, not literally into depth, but actually what does it mean and what are the outputs and what are the advices. So that's a new digital skills that is relevant. And finally, to touch upon the green skills, those gaps are awareness. So awareness that each professional has a footprint, has a responsibility, but also has effects in their practice in terms of environmental effects, in terms of prescribing, in terms of the waste, energy, etc. So these are the things that we as citizens also know and should be aware of. But secondly, climate change has consequences for health in populations. And this is not only public health. Public health professionals know this. They monitor this. This is their job. But also in general practices, in primary care and hospital care, we see new types of diseases and impairments and new types of patients that professionals should be aware of. What is the relation with climate change and with environmental developments, including climate refugees, etc. So, in short, Federica, this is what you can read in the policy briefs and many things more.
Thank you, Ronald. One of the things that came up from also the consultation, which is one of the outcomes, and it's included in the skills strategy, is for digital skills. The digital skills are at the forefront, so everybody agrees they are urgent, they're immediate. But then when we did the survey with health professionals, they were really keen on getting basic digital skills. So some of the most successful courses were around the Google Suite or how to use basic IT skills. And then when it came to green skills, normally the first question that we get is, but what are green skills? So can you comment a little bit on these?
Yeah, well, partly what I just referred to, green skills, is still, I mean, it's hard to find a new definition because it's an emerging field, an emerging thing. But basically, the two types of green skills in terms of awareness and of your own footprint as a professional, but also in relation to communication with patients, and also be aware that, of course, if we would be successful also as professionals to reduce health consumption and health use, this will also, you can easily calculate what would be the effects in terms of travel and all the environmental effects of this, of less consults and visits in hospitals. So the awareness of this and the ability also to quantify this, that is, you could say, a green skill. And then the matter is, of course, how to, well, if there is a green skill gap, how to close it, how to solve it. And then, of course, obviously, you need to look at training and education, basic initial education, with the problem that, of course, many the education for doctors and nurses are fixed, right? So the curriculum is fully packed. So the education would say, well, there's no space for this. Why would we include this? So there's an interesting challenge there if you want to really integrate it into curricula. And secondly, of course, it's not only about the new generation, it's about the current generation, of course, to have that included and have that being trained, these green skills also in continuous professional development. And there, well, as part of the BeWell project, we developed a skills monitor to show and to have a tool in which you will find 400 courses, trainings on digital and green skills, which are open access and available in the English language and other languages as well. And that is, of course, the other way to close the gap. And I think typically in training and reskilling the green skills and digital skills is an opportunity also to provide training in a flexible, open and easy way, because if there is one problem in healthcare provision, it's time. And it takes time to train, it takes time to educate. And so the more flexible we can provide these green and digital skill trainings, the better.
Thank you so much, Ronald. And I wanted to come in because you, in fact, mentioned that it becomes a training problem. Like the way to solve these is through training. And to move a little bit more deeper into the skill strategy that we have developed with BeWell. What we have noticed is that often skills issues are then responded to in a fragmented way. So there is a training here, another training there, and then, well, let's add another one, without taking into account then that curricula, sometimes especially for health and care professionals, are already very packed, so that it becomes another problem. And the other thing that we developed that we discovered when we developed the skill strategy, and we did an extensive consultation with over 700 responses, was that there are several barriers in terms of lack of time, other pressures, of course, from the system, again, the packed curricula. And so it's all about implementation, which is the reason why in the strategy we did develop multi-level implementation pathways at the European level, the national level, the regional level, but also how universities can then implement the skill strategy itself, and how healthcare professionals individually can implement the skill strategy. And so let me pass to Michele Calabro, director at ERIGA, so local and regional health authorities. Michele, I think that the question of implementation for you is key for you, your members, and the constituency that you do represent. So what role do regions play in implementing skill strategies for the workforce?
Yeah, no, thanks a lot for the introduction, Federica, and first of all, thanks also for the invitation of being here, and as well for the leadership as well that you had for the BeWell project. I think was a great pleasure for us as a network of regional and local health authorities to be part of it, and indeed try to make that bridge with implementation. So just to give you the context, essentially, why it is important to look at regional and local health authorities. I think we had a great example here, of course, in Catalonia, but actually in about 2/3 of European countries, healthcare is managed at different levels at regional or local level. Spain is a perfect example where the comunidades autónomas are, of course, looking at that from a very direct point of view, but it is happening in many regions around Europe. So first of all, that's why it's important to look at implementation at regional levels, because that's where essentially it happens more than we think, maybe more than we can usually imagine. Second point of view, I think one very important element of working at regional and local level, and again, we had several examples on different topics in these days, from the outcomes measurement session the other day was very interesting. It's the capacity at regional and local level to bring together an ecosystem that really is able to talk to each other, understand what are the needs between the healthcare delivery side, the healthcare innovation side, and also, of course, in the case of this discussion on the skills development side, as well as having a little bit of a better understanding also from the cultural point of view of what are the workforce needs, but at the same time, and this is another important element at European level, the need to have workforce development in healthcare and beyond as a matter of regional development, talent retention, talent attraction. So we see at regional level not only the healthcare side in terms of delivering to citizens in a very close and direct way, but at the same time working at it at the regional level, it also means increasing the attractiveness and, dare I say, competitiveness of Europe. Let's say one region, one local authority at a time. Sometimes it's easier, of course, to do it than at national level, especially when we're thinking about large nations across Europe.
And Michele, you mentioned just a few seconds ago several examples. Can you give us some practical examples that you know of at regional level? You mentioned Spain, but I'm sure you have plenty of other examples from your members.
Yeah, no, absolutely. And indeed, our network, it brings together regions from different countries. I think we heard a lot, of course, of examples about Spain, in particular Catalonia these days. So I wanted to bring an example from Italy, for instance, as we recently had a discussion with representatives from Emilia-Romagna region, which is also one of the regions that were involved in the large-scale partnership. One of the activities of BeWell concerning development of skills in artificial intelligence in healthcare. What I wanted to bring is the example from this region, as it's a really recent and ongoing activity whereby there was the need identification, first of all, of the importance of implementing artificial intelligence in healthcare. I think it's something that everybody is thinking about on a day-to-day basis. But the approach that was made was from, let's say, not that just develop a series of courses and just develop and just give them to professionals. But the skills development element was work at the regional level from a governance point of view. So there was, first of all, a clear identification of all the needs and gaps for adoption of AI in healthcare. Skills came up as one of the elements on which then the region decided to develop this broader governance to adopt AI in healthcare. So a part of the entire strategy, not just one-off activity. And how I started to develop this specific AI focus, it created a really dedicated ecosystem at the regional level, bringing together the regional authorities, of course, so the departments of health, departments of innovation, the departments dealing more with the educational side, the department dealing more with the innovation. The innovation ecosystem, what are called usually life science clusters and similar, so to understand the need from the industrial development point of view, the hospitals, the local health authorities, and of course professionals and patient organizations. In this way, created sort of an advisory board that then led, from when it comes to the skills side, to really start in developing sort of a heat map, and I'll be also happy to share it if somebody's interested, that really identifies per each category of professionals what would be the most urgent and maybe more future-looking activities. A little bit like we did as well in BeWell, but with a really specific focus on AI and for the regional ecosystem. I think it's an important example because it shows kind of a bottom-up activity, but that's also where we need to start in many countries.
And Michele, clearly it seems that co-creation is a big part of what you have described as an approach. But then what about barriers? Do you know, like, what are some of the barriers that regions have to face in implementing skill strategies? And maybe if you have some example of overcoming these barriers as well.
Yeah, I mean, the examples that we've seen, I think, is also the same that also Ronald mentioned before. I think it's a matter of course, we have fragmented approaches across Europe in terms of how skills development work. We know that we have all the related cross-border movement issues as well. It's a matter of financing as well. Clearly, things cost. It's long-term impact, so it's always quite complex to decide heavy investment in education, especially because essentially most of all in digital we kind of starting a little bit delayed everything that we do. It doesn't really matter how advanced we try to do things. We already kind of gonna be late the moment that we implement. But one additional specific examples, specific maybe to what I was mentioning, it's also the regulatory dimension, also for those who are working, for instance, in artificial intelligence, to understand the complex ecosystem of regulatory activities that, for instance, happen from the European level and then to be adopted at regional level. So the distance as well between not only what needs to be done in practice, but also kind of the rules and laws that govern digital, mostly in healthcare, but it applies actually to green, circular economy, waste management. It's another element that, again, it's complex because it tackles different level in governance.
Thank you so much, Michele. And let me pass to another panelist. We have here Dr. Marius Ungureanu. He is Associate Professor and Department Chair at Babeș-Bolyai University. He's also a partner in the BeWell project. Marius, we heard from Ronald, he mentioned these, Michele re-mentioned it again. There is, curriculums are packed, especially for health and care professionals. So how can universities, you clearly come from a university, that's where you teach, how can university align their educational offers, their educational programs to what are the future skills needs of the health workforce?
Thanks a lot, Federica, and it's a fascinating conversation. And as I've been reflecting while preparing this intervention, also listening to colleagues, I believe that many times, and I don't know, maybe it's valid for those of us in the room because we are also part of the workforce. Sometimes we are very big fans of workforce transformation. So if anyone would ask us, do we want workforce transformation? We would all say yes. But we are part of the workforce. And do we want ourselves to be transformed? I'm not sure about the answer. So we should start from that in the sense that we're speaking of workforce transformation. And this is in the context of health systems transformation. So apart from what you already mentioned, how do we train and how do we design curricula and how do we update curricula, we need to also be aware of the fact that this transformation needs to serve the objectives of broader health system transformation. Now, that is even more complicated, so I'll not touch upon that. From the very beginning, I want to make a brief disclaimer. While I'm trained as a medical doctor, I'm not working in a medical university. It's been 16 years since I'm working in Babeș-Bolyai University in Romania, which is the largest in Romania, but our Department of Public Health is based in the School of Political, Administrative and Communication Sciences. And I would reflect a little bit on that because that is quite atypical because our students, we have a bachelor, master and PhD programs in public health services and policies. They are immersed in the learning environment which takes place in the School of Political, Administrative and Communication Sciences, which is about 4,500 students. And so one thing that we are doing is to create, apart from having constant dialogue with employers with regards to adjusting curricula. So over the years, we've had, for instance, for our digital health and innovation course, we have a guest professor who's leading the digital health ecosystem in the Cluj area and also having a strong role at the national level. For the healthcare management course, we are partnering with hospitals. We're collaborating with a different hospital each year to provide our students practical exposure to healthcare management experience. But one thing that I wanted to highlight is that apart from the very specific technical skills, which are really important, I want to highlight something else which many times is not given the proper attention, which is cross-sectional skills. Because we are training the workforce for a system which will already be different when they graduate than how it was like when they entered the educational process. And so in order to do that, we focus a lot on collaboration, we focus a lot on critical thinking, on interprofessional work. And we have an initiative in our school. We just concluded the third season of that, which is a living lab, which I'm sure maybe many of you are familiar with living labs, but the way we do it at our school is that we are working with partners, with a variety of partners from public institutions, private institutions, NGOs, public authorities, to co-design challenges that they're facing with. And then we have teams of students who are from public health, from communication and public relations, journalism, digital media, public administration, political sciences, and they work together with our professors and with representatives from the partners to address that challenge, and then they present the challenge, and many times they present the results, and many times they lead to outputs which are further used by our partners. So for instance, last year we worked with the hospital to develop some practical satisfaction collection tools for those who access emergency services in one of the hospitals in the city. And so that is just to say that we are looking at, we need to be looking at cross-sectional skills in a matter which is integrative, because as you rightly said, we unfortunately have lots of fragmentation. And I believe, I mean, I want to end in this bright note, that the very fact that EMA conference this year takes place in a business school, I believe this is amazing, because we need to build these bridges between clinical professionals, public health professionals, business professionals, and other categories, because we will not be able to tackle the challenges of health systems in the way we used to do it.
And to your point, Marius, around core competencies or transversal competencies or soft skills, there are a number of terminology, but as we understand what we are referring to, the survey, the consultation that we did for the skills strategy really revealed how crucial they are for the implementation of everything else. So for digital skills, for green skills, you cannot implement those two without those soft skills. So this goes to your point as well. And Marius, the other thing that I wanted to ask you, because Michele hinted to this, clearly, especially when it comes to digital skills, we are always behind. Like we are implementing something and the technology has changed, so we're sort of catching up more than being at the forefront of anything we do. And this also brings to the need of lifelong learning. We cannot just expect that what is happening today in the university is what remains valid for years. So what are some trends that you are seeing in terms of lifelong learning? How can universities support lifelong learning?
This is something that we also experienced as a department and as a school, because we started with our bachelor and master programs, and our mission from the very beginning, our department has been founded 20 years ago, and our mission from the very beginning was to build capacity in the Romanian health system. And we discovered a couple of years ago that we are missing something. We are missing the workforce who has been trained, many times does not have too many opportunities for lifelong learning, and that is why we decided to start an executive program for health policy and healthcare management. But moreover, what we realized that to be really important is to not have the different universes with our bachelor and master students on the one hand, and professionals doing lifelong learning in another universe. So I believe it's really important to put them together. Apart from that, universities, I mean, many times when people come back to universities for lifelong learning, they realize a connection to learning that they seem to kind of lost it. But also what we know, I mean, the elephant in the room is that the healthcare system is not very willing to change, and of all the systems, maybe the medical system is one of the most rigid. So to that end, I believe that we need to identify and to showcase the best practices and things that work, that potentially we have this chance of expanding the knowledge through lifelong learning. And one last point I wanted to add is that many times things do not go as we would love to, and there's something funny that I experienced just at the beginning of this week, as a matter of fact, because I'm advising a startup which is building some solutions in artificial intelligence for health institutions, and I was discussing with the CEO of a private clinic in Cluj, and I was asking him, what is the adoption? How do your employees, be they clinicians or non-clinicians, how do they you know, embrace or not, because I know from other parts, from a big hospital which implemented or tried to implement AI solutions, it was only 10% adoption rate among clinicians. And he said, well, this, when we hire people, this is something that is in their job description. So they don't have a way out. And I know that I'm trained as a doctor. I know that for doctors, autonomy is the biggest value. So many times doctors don't like to be, you know, patronized. Maybe this is a strong word. But the reality is that sometimes transformation needs to be, you know, put really upfront and you know, as a core value, and that needs to be adhered to.
Thank you, Marius. And one last question to which you sort of hinted with the examples that you gave. How do you collaborate with hospital, with healthcare providers, and how are you able to absorb the needs of people in practice on the ground?
There are a couple of things that we do, and I don't want to brag about our department, but we kind of pioneered that in our school, which now is a tendency that our school leadership is imposing to all of the departments. We are very much linked to our partners in the healthcare system, and one thing that we do is that we have lots of guest lecturers from clinical settings, be they the public, the private, the NGO sector, who are lecturing to our students, and that is one of the contexts in which we get them in contact with our students, and our students with these partners. Moreover, we have a very big roster of institutions where we place our students for a practicum, because many times when I'm discussing with I don't know, a new hospital manager or someone at the county health insurance house or district public health authority, and I tell them what our students can do, maybe for them it's a bit difficult to imagine, but when they have them there, or when they come to speak to our students, that is when they actually realize what could be done. And then last but not least, as you said, I pointed out already to that with our living labs, because that is also where ideas are brewing, and we do you know, iterations and improvement from year to year, having this context of meeting our clinicians, you know, administrators, so on and so forth.
Thank you, Marius. Thank you so much. And I think that this is a good transition to our next speaker, which is Dr. Montserrat Codina. She is an international project lead here at IESE Business School. And as we were mentioning at the very beginning, you are involved in the BRIGHTskills project, which is sort of a sister project of BeWell, just looking at a different part of the health sector, which is the industry. So you've heard the skills intelligence that we have developed during BeWell from Ronald. You have heard a little bit from Michele, also a partner in the project. How does the skills intelligence that is being developed from BRIGHTskills differ, or how are the skills needs different in the industry health ecosystem?
Yeah, thank you, Federica. And yeah, it's when you discuss all these points from BeWell, it really familiar to me, because we are, as you said, and the BRIGHTskills is sister project from BeWell, that the little sister, let's say, because you are a bit more advanced, we are just at the beginning, so we are watching very closely what you do and the learnings from your project. So yeah, basically the aim of BRIGHTskills is to equip the current healthcare industry workforce, build the skill needs of the future, and maybe we focus on four big areas, on pharmaceutical and biomanufacturing, on medical technology, medical supplies, and digital health. So, and in line with what you were saying, so the project aims to do a skills analysis on what are the needs of the workforce, then also build a health industry for future skills observatory, establish a skills strategy. We are starting with that, and based on the skill gaps, so try to develop courses that cover these gaps. we have already, the last year, we have done this skill gap analysis, and we are not ready to show all the results, but we have some preliminary. And well, a clear conclusion is that there's a clear misalignment between the current training offers and the specific needs of the healthcare industry sector. And I will discuss a bit more on the different competencies, but what it surprised me a lot, and I would like to highlight, make it clear here and highlight it, is that there's a strong demand of hybrid profiles. So this was one of the things that the industry really highlight. And this need of those profiles that are connecting teams for clinical with technology with business, or technology with regulation. So these are really the roles that industry is missing at the moment. So yeah, this is one thing that we really have to address. If we go a bit more in deep into the different competencies, and some are very, very similar to the ones that you described in BeWell, but the angle in which the industry is a little bit different. So some of the more important ones are in terms of regulatory, as I would say, and quality, data and AI literacy, very much on interdisciplinary collaboration. That's also something that you, Marius, were defining on this cross teams of different profiles, so that it's, as I was saying, in line with also these hybrid roles in which trying to work with clinicians, engineers, IT departments, and so on and so forth. Also a bit of health domain literacy. So many of people in the industry are very technical in the sense of digital AI, but then they like a bit of this vision on whatever they design needs to be embedded into a clinical pathway. So sometimes this is a bit what they claim as one top competency. Then definitely other competencies that are important: cybersecurity, interoperability. So we have discussed during these days also issues of interoperability, and so on and so forth. But still, recurring gaps are, as I mentioned, in relation again to these hybrid profiles, is commercial teams usually sometimes lack of these technical profiles, or regulatory or healthcare systems knowledge is missing in some digital professionals, or in some scientific roles, some strategic or entrepreneurial thinking is missing. So this is a bit some of the main outcomes of this first results of the skill analysis. And yeah, based on that, we are trying now start offering the first batch of courses. So now we are offering 3 or 4, but based on the results, when we have these results more mature of the skills analysis, so then we will start already a second batch of courses now from June on.
Thank you, Montse. And clearly, I mean, our project is finishing this month. Yours is on the way to develop courses. But how do you think that projects such as BeWell, which is not the first, hopefully will not be the last, and BRIGHTskills can contribute to a more coordinated way across Europe to build skills and to upskilling and reskilling?
Well, I actually think that these projects are a way to put the seed and to start make it grow, in the sense of these both projects brought the different stakeholders that are responsible for this skills strategy go forward. So they put different stakeholders together. So both projects have not only academia, but have industry in our case, providers in your case. So I think they put all the stakeholders together. They work together on highlighting what are the needs of both sector. I would say both sector is the same sector, but from a different point of view. What are the needs, and start showing what has to be done and how can be done. This is, I think, as far as we, or even pilot a few things, and as far as we as per project can go. But then the question is, what comes next? How can we make this a reality? And this is also a discussion we are having in BRIGHTskills, and probably you have already discussed this, and this is something that we will be pay attention on BeWell. But I think then, based on all these basics seats, and then it's a matter of how then we just continue and make it a reality, a full reality. Mm-hmm.
Thank you. And again, you're referring to, yes, indeed, something we have discussed, which is all about implementation. Now, in BeWell, we have a skills strategy, and then now it's like, but what do we do next? How do we put it in practice? And it's a great way for me to introduce Lucia Rojko. She is from the Ministry of Health of Slovenia. And Lucia, the reason why we have invited you here is because Slovenia has in fact developed a workforce strategy, which I understand is the first in the country. So can you share with us a little bit about the work you have done, how maybe some of the barriers you have encountered, some of the solutions that you have found to these barriers?
Yes, thank you. It's true, this is the first workforce strategy in Slovenia ever, and it was accepted this year, and it will be for the next decade. We have several focus areas, but main are education, reform, recruitment and retention, improved working conditions and long-term workforce planning. Now, what are the things that we noticed when we were starting to organize the process? Was that we have many different professional groups. Maybe if I just mention at the beginning that we are a small country, there is 2 million of us, and we have, of course, as any country, different professional groups, but it's funny that we're small and we cannot come together easily. Each professional group is really gardening their own silos, and they cannot usually they cannot see beyond that to see the general benefit with different reforms. So our goal was to really invite all those professionals together and really discuss about things in a way that they could hear from the other side and really create goals and activities that we want to implement with the strategy that would address all of them. With that process, we also wanted to encourage ownership for the implementation of the strategy, because we cannot expect the successful implementation if people are not included in the process. They don't feel that this is, their baby too. If you want to implement something successfully, you have to take care of the inclusion of all the professional groups from the beginning and other stakeholders. So this is the thing that really paid a special attention to, and for now we think it was really successful. We still have to make a concrete action plan. This is the goal for this year, but we have very concrete activities already in the strategy. Other thing that we see as maybe an issue or a problem we still will have to overcome is that the continuity of the strategy. So maybe because this is still a national strategy, the government accepted it. Government, changes, people change, and the problem is when it's not a priority. From one government to another. So one of the important things is to also take care of to keep that as a priority throughout the 10 years that it's meant to be. Now, maybe if I mention digital skills are also included in the strategy. What we noticed in the practice is that, of course, this is a huge need and potential that can really help the healthcare and healthcare workforce to really, take care of all the needs that need to be taken care of. But in practice, for example, in Slovenia, for nurses, we have already some digital tools implemented, but often it happens that this causes double the work for some professionals. They have to write everything down on papers and additionally put them into computers. So this is something that we want to avoid in the future. So we have that in mind, and it's really connected with the policy, with regulation, and the other thing that is very important also is I mentioned education reform. We really need to take care of our educational programs, as it was also mentioned, to really answer the needs from the field. And one thing, okay, digital skills is one thing, but another is interprofessional collaboration. That is very important. Simulation training is one of the good practices where different professionals can practice not just to master specific skills, but also how to communicate together with different professionals to achieve one goal. And also it can be simulation related to communication, to maybe get to know the tasks and roles of another professional, because this is also something we notice it can cause maybe you know, not really ideal communication among professionals when different professionals don't know exactly what the role of another is. So we have to really encourage the communication, encourage this culture of collaboration, starting in their educational years when they're training to be a nurse, to be a doctor, or any other kind of professional. So this is something that we feel is very important.
Thank you, Lucia. And speaking about collaboration, one of the things that we have been discussing as part of the project, but that comes up routinely, is clearly there is a component that is the health component, because we are addressing the health and care workforce. There is another component that is the education component that normally pertains to a different ministry. So were you collaborating across ministries? How were you collaborating across ministries? You mentioned the difficulties of bringing together different professionals, so I'm curious now about how easy or not easy it was to bring together different ministries and different political parties around the table.
Yes, I'm not gonna lie, that was a challenge as well. I think it reflects through all the levels, but we managed to get everyone in one room. We did include Ministry for Higher Education, for example, but now it's time to really continue that communication with them. It's not just, you know, they were not just included, you know, 2 times at this policy dialogue or maybe some meetings that we had. We really want to create maybe something that would be really regular. It's not just the strategy that we want to address. There are several things also related, let's say, for example, data, you know, how many people are graduating, how many people are applying for different student programs, and so on. So we have a lot of things in common, and our goal is really to have it implemented as something regular. And it's also something that we did include in the sustainability of the strategy.
And Lucia, what would be some lessons learned, something that you could share with the audience in case they want to engage in developing national strategies? What would be some maybe 1 or 2 things that they cannot really do without?
Yeah, before the transformation was mentioned, strategy is something that is transforming healthcare in a way. So it will, of course, have, as a consequence, it will have a bit of a resistance when it's going to be implemented. But to prevent that or to minimize that, it's really important to really include everyone possible at the beginning or even before the beginning. For example, we did 2 national surveys before we even started the policy dialogues and other activities related to the strategy. And as I mentioned, ownership and really to help with the implementation in the end, it's something that can be only done if all the relevant stakeholders are included from the beginning and heard, and you know, we really tried to answer all of them, even though if we didn't include some of their suggestions. We tried to answer it, we tried to communicate with them, and usually they were really calmed down when they heard that, okay, this is true, but it's not in the strategy because it doesn't fit there, but it's going to be included in this activity later on. So this is something that, yeah, that we think is really important.
Thank you so much. Let me open up to the audience. Let's see. Yeah, I already see you are very fast. Thank you very much. We're going to get you a microphone very quickly.
Hello. So thank you so much for sharing your experiences. It's actually very aspiring to learn a lot from those experiences. But I was wondering if any of you had the chance to experiment engagement of patient and the public in those education programs. You know the importance of patient empowerment nowadays, and how is it important to learn from the patient experiences. So if you had the chance to engage the patient within your education program of the healthcare professionals. And my question is open to all the panel sessions.
Maybe I can start. I would like to address this question, but maybe not from the BRIGHTskills project yet, because one of the things that we, of these both projects, is that sometimes we're trying to design courses that with a huge outreach. So sometimes we just have to develop online courses. This is what you mentioned. We have applied in other projects that we have contributed. So there was one. We also participated in a digital medical device summer school. It was in person, and in which we just put together different profiles of doctors, engineers, different biotech, whatever. But then we always, they had to develop a digital medical device from scratch, but we also involved the patient from the very beginning. They had to really talk to patients. They had to really patient advocates in the audience. So yeah, this is, but this is a bit more. We had to do it when we can do it something in person that can be long. In this online training, sometimes you just can't mention. It's a bit more difficult to that they experience that. That's my.
Yeah, just I think specifically in the example that I shared, if I'm not mistaken. There was like kind of a clustering of different categories, and of course in terms of patients, they were consultant as part of, let's say, more on the user side. So indeed there was like users that are professionals, they are patients, and then there was a regional authority, innovators, and so on. And this is actually it's a very important point, because in the end, of course, as with digital, of course, but any innovation, it's not useful if it's then not used, and it's not actually providing benefits to those who should be the ultimate target of what everybody here is doing every day. So working to improve quality of life for citizens and patients. And actually this is a trend that we see more and more in many of our members, not only from the point of view of skills, but also from the point of view of kind of formalizing the involvement of patient organization in healthcare planning. I mean, just another example from another of our members, Basque Country. Recently, they released a comprehensive cancer plan at regional level, and in that case, indeed, as it's happening in many regions in Spain, there is an element of formal consultation with patient organization on the ground. I think it's an essential thing that is happening in many cases, and it has to be part of the discussion, of course.
Can I ask the question? Okay, thank you for the presentations. I will be doing a presentation afterwards on the HGS, and I would like to address the idea of the moving target that Dr. Ungariano was discussing, and the idea of the living lab. And my question is, how do we move from a valid, let's say, user experience pilot in a given hospital to a more ambitious deployment in any given area, let's say, still acknowledging and addressing the idea of the moving target. We have discussed about leveraging best practices, and the idea of the living lab is interesting, but scaling is a major challenge in operations, implementation, governance. What are the important, let's say, elements to look at while scaling?
Yeah, thanks for that. I believe this is a very valid observation, and I believe what is worth mentioning is that even if I haven't labeled it as such, clearly what we're doing is a bottom-up approach, which is quite limited to our city, to our partners, and we're trying to build it from the bottom up. Now, of course, I do see the limitations of such an approach, because it is quite limited in scope. In order to move from a pilot to full-scale implementation, you need a lot of ingredients. I mean, you need resources, and it's not always about only financial resources. My own home country, Romania, has had access to a couple of billions of euros through the RRP mechanism from the European Commission. But many times it's not only about the financial resources, it's also about the workforce, the human resources, the people who need to have the expertise and the skills to take it from pilot to full scale. You need also to have the full information scale at hand. But if we look at that, I believe it doesn't tell the full story, because in order to move from where we are right now to where you were pointing towards, I believe we need to complement that with a top-down approach. And I believe there are limitations to each one of them. I was both fortunate and unfortunate, I would say, to have been put in that position. Our colleague from Slovenia was describing the process of developing the strategy. I was in those shoes 10 years ago when I was a deputy minister of health in Romania, and we've done the same thing. And I've seen how that there are clearly advantages of bottom-up, but there's also huge advantages of having this top-down approach where you can, instill, or maybe through various tools like passing new legislation or, developing and implementing skills. So to sum up, I would say that yes, I share your concern, and your question is very valid. The way I would see it is that first of all, we need to, through these pilot initiatives, to work on, creating awareness, mobilizing resources, but at the same time to focus on the on the top-down approach, because if we are to see full-scale results, I believe the two should work hand in hand.
Just 1 second, because it's an excellent point, and I think also the colleague from Slovenia and partially the example that I mentioned show a possible solution to that, which is creating governance structures and strategy that really try to make the effort to get everybody in the room from the very beginning, because we see, and the problem of scaling up and uptaking, it's something that it's been plaguing healthcare innovation for many years. Often the ones that need to adopt and scale up are a little bit of an afterthought. I think it happens, for instance, with patient organization, but it happens as well with public authorities, with implementers. I was a patient advocate some years ago, and now I work with regional authorities, and often we see, even like in European projects, to give you an example, maybe led from the innovation side, that asking a patient like what they think about a certain innovation, and asking a public authority whether they're interested in buying, whether there's a system for buying that, it kind of often comes like as a little bit of an end game. So I think that it's something that needs to be, we need to change that, of course, and I need creating structures that take that strong cohesion at the beginning, having a common language from the get-go is the way to go. It's a bigger effort at the beginning, but I don't think we can afford to spend a lot more time with, especially in the healthcare sector, in moving ahead innovation without really not having everybody on board. Otherwise, it's a matter of time, it's a matter of not delivering patients better healthcare, it's a matter of also like wasting money.
Thank you, Michele. Can I see if there are any other questions? Yes, of course, Jaume. Come on, microphone is coming.
Thank you. We talk a lot about this continuous education, but I think there is a core issue, which is at the center of our health systems. There are doctors and there are nurses, and they are exactly the main point in there. And when we train initially these doctors and these nurses, they go through a period in the university in which they learn a lot about organs, physiology, diseases, treatments, etc. And they spend, at least in Spain, after they finish the medical school, they spend a whole year preparing for a state exam. And in the state exam, it's just a multiple choice form. And it is when they join the residency later on, when they are already busy with what they call very long days, very long weeks, and very short years, because everything moves very fast, that they realize that there is much more to the medical profession than knowing all this and doing very well on the multiple choice form things. They need to communicate with patients, they need to work in teams, they need to innovate, they get to know some digital knowledge, and none of these have been taught to them in the past. And some universities that try to do that, they face this, teach them something on digital medicines, for example, and the students say, excuse me, is this going to be part of the exam or not? If not, okay, I will do it later. So we, at the moment that you start, in terms of this continuing education, we start already with at least 10 years in which we could have prepared this workforce, and we have not done anything so. I was talking with some medical faculty in the past, and they say, well, the health system may take a generation to change, but the medical school may take a century to change. I don't know, what is your view on that?
So we're playing catch up.
Well, I'm in a very privileged position to speak because I'm not working in a medical university, so no one will take me by the ear when I get back home. As I was mentioning, and I believe many of us, most of us, all of us would agree that health systems are rigid, and medical universities among higher education institutions are even more rigid. Well, so when we look at that, I will speak again about our experience with our programs. What we see, particularly with our executive program, because we already will enroll our 4th cohort. It's a small program, but it's growing. We see that we have many people who are clinicians who enroll in our programs, but those are really champions who really understood that the health system and working in the health system, even as a doctor or as a nurse, takes a lot more than, as you said, doing a perfect job at doing the multiple choice questionnaire. And I believe that maybe, just maybe, it's my personal assumption, the transformation will not necessarily come from inside the medical universities. Maybe it will come as a nudge from the outside, from these people who are champions, who will, when put in key positions, will be able to carry the educational system with them. And now again, speaking on my own example, being outside of the medical university gave me a great perspective, because when you are inside the system, after a while, you cannot discern. It's like the classical example with the with the frog in the boiling water. If you increase slowly the temperature, it will eventually die, but it will not observe the transition. And so I really believe in champions who see the realities, they accept to take the less beaten path, who accept to be sometimes ostracized. I mean, I've seen that in my home country when people, speak things which go against, the conventional approach or the conventional wisdom. But I believe this is how things will change, and this is how things will transform. And as I look in the room, I see lots of young people, many people younger than me, and it is my, without leaving aside the wisdom of people who are older than me, but I have great hope in the people who are younger than me in the room being exposed to events such like this that will so let's do an exercise. Who in the room is doing clinical work, being trained as a clinical professional doing clinical work? There are a number of people, so I believe it's people like these who are champions, who are listening to these conversations with open minds and open ears that are able. I'm not hopeful that will happen tomorrow or the day after tomorrow, but there's this saying, I don't know, it's a proverb saying that the best moment to have planted the tree was 20 years ago, but the second best moment is today. So I'm a great optimist in starting and not giving up on that.
Thanks for the optimism.
Any other questions in the meantime? Oh, yeah, sorry.
Hi. Great presentation, everybody. I'm from Slovenia, so yay, Lucia. But I would have to agree and disagree with the last comment. And I didn't hear enough about something that I experienced as the most difficult part, and you asked a question about it, is that here in this room, it should be sitting a lot more of policymakers, and they should be the one who you planted the seed today and 20 years ago. Because in Slovenia, we had a privilege of having a prime minister who was really focused on health and healthcare sector and healthcare workforces. And that also showed in the Ministry of Health, and then our minister was really supportive, and our state secretary, who should be sitting here today but got delayed, was very supportive. And of course then Lucia, as the chief nursing officer, finally got to do her job, her dream. So I think that we talk a lot too little about the policymakers, and that they are the one we should be influencing. So it was just my input that this, what you said, is something that we should be talking to them.
Thank you so much for the comment. I fully agree with you, and I would even raise it further and say that it's not only policymakers, but it's political decision makers, and I'm sure that you've had that in mind. And again, I'm going back home, I'm going to my university, no one to take me by the ear, but last week I was part in a conference, in an international conference on NCDs in Chisinau, Moldova, and the moderator asked us, and she was building the scenario, what if you had a magic wand, all of the speakers in the panel, what would you do with a specific scenario? So I would, even if Federica didn't provide me the magic wand, but if I would have a magic wand, I would make sure that all of the political decision makers in my own country, in the health system, and related sectors, education, transportation, economy, would go through a very intense type of training. And we have the Barcelona health financing course taking place here in Barcelona every year, and we have the Observatory Summer School in just a couple of weeks in Venice. Then if they don't pass the exam afterwards, I would fire them. Now, this is really fantastic, but I don't have that magic wand. So instead, in my experience, because I was an advisor to two health ministers, I served as a deputy health minister and the chief of staff to the minister without being politically involved. But all I want to say with that is that I've been around politicians, and things do not change with the speed or with the, you know, to the extent of our wishes if we were granted a magic wand. So I believe in order to get to where you are pointing towards, which I fully agree, there, I'm an optimistic again, but I believe that we need to give up the paradigm in which we've been raised, you know, because most of us are researchers, and the you know, the old paradigm was that we are presenting scientific papers, we are you know, writing peer review articles, we are in our ivory tower, and people should come to us for knowledge. And the reality is that politicians will never knock your door to say, oh, mighty researcher, tell me how to do that. And so instead, we need to climb down the ivory tower to build relations and to engage in conversations, to make sure that we are not speaking our foreign language of research. Not when I first went to the Ministry of Health, 2016, I was under the impression that if I have published and I had great publications with Ronald and other colleagues, it will be enough to convince people in the Ministry of Health to do the things that I knew were right to do. And guess what? Were they interested? No. So that is just to say that I still believe that there is hope if we engage meaningfully with them. And the last thing that I want to say is that politicians are really different, and I was fortunate enough to work with one of the ministers who was, I mean, the ideal politician, I would say, because not only that she was, and first, she was lady, and I really appreciate that. And it is my own personal observation that women politicians are better than men politicians, but it's just my opinion. But she understood what we as researchers were speaking, and she was willing to learn. And I believe this, if only this, we would be able to ingrain more in politicians you know, the desire to learn, and giving up the idea that they know everything. Maybe that would be even a small beginning.
Thank you, Marius. And you gave me a great idea to conclude the session with the game of the magic wand. So starting with the, you already had your wish, so you can't use the magic wand twice. So starting with Ronald, if you had a magic wand, Ronald, what would happen to support workforce transformation?
No, I think I agree with you, Marius, that we should come down from the ivory tower, or maybe we should build an elevator to make it easier for politicians to reach us. No, but my wish is indeed to come closer, and there's a mutual learning and a mutual dependency. And so also between the research domain, the educational, and the occupational domain you were talking about, I think that the collaboration and the alignment, that is key. That is key. So my wish would be that the alignment will be more or less improved. Yeah.
Thank you, Ronald. Monse, what's your magic wand wish?
Yeah, I think it's going to be a bit in line with what you're saying. I think if anyone going through training would be 1 week seconded, and I'm taking secondment as what the Marie Curie's fellowships mentioned secondment. So stay 1 week, 1 month in another position, not the one they are currently. So I think many walls will just fall down. So I think being in the shoes of another one and experience what the other, so I think that would be at least something to be done.
Thank you. Let's go to the end of the line. Michele, your magic wand, and then Lucia.
Magic wand. Maybe having the possibility to freeze the time for a while and actually have, you know, detach all the maybe politician elections to election time, and really also for all of us that are kind of going on a day-to-day basis, really have the time to look around, see what's happening, see examples from other countries, from other regions, from other hospitals, and really try to have the time to pick the best and have the time to implement it without being submerged by the day-to-day activities. I think that would be really nice, but I don't think it's going to happen.
It's a magic wand, so who knows? Lucia.
because I think you stole a few of my thoughts before, I will say something else. I really wish that the image of healthcare professional would rise to the level that it used to be, because we have issues with recruitment, with retention. I wish that we create working environments that would be in such level that people would really strive and fantasize about being a healthcare professional. So that would be mine.
Well, thank you so much. Thank you all for your insights, Michele, Lucia, Ronald, Marius, Monse, and thank you all for being here. Once again, if you have missed this, you can get credits for it and continue in your continuous professional development. Thank you so much and see you later.